Welcome to the Friday Value video. And I started a topic of essential oils last week. And the intention of these videos is to be fairly short so that you have time to view them and gain some knowledge that could be beneficial for your life. So there may be a part 3. There's a little bit more information I'm going to want to share next week if I don't get to it this week. So I want to remind you of part 1. Essential oils have wonderful therapeutic properties, antiviral to anti-inflammatory. And that is really important for you to consider because a lot of chronic pain issues are due to inflammation. And be very sure that you do not end up wasting your money on perfume industry knockoffs, leftovers, things that they would like to throw out, but they're going to make money off it. It might smell good, but it has no therapeutic value whatsoever. If it's really cheap, it's not going to benefit you. Essential oils aren't all that pricey, but if you're getting something for just a few dollars, it's probably not therapeutic. It probably won't help you. And a reminder to use a carrier oil as appropriate. And there's lots of them: coconut oil, olive oil, argan oil, almond oil. The general rule is at least 6 teaspoons of carrier oil to every 15 drops of essential oil. That's on average, but you can do some research and you may find some different proportions dependent on the essential oil you're using. Some essential oils you can put directly on your skin. Some are not advised to do that, and you need the carrier oil. Now, there is an at-risk population. There are some populations that are at a higher risk of having sensitivity to essential oils or herbs of any kind. It doesn't mean they can't use them, that they can't benefit, but they might have a greater sensitivity, and you need to be very careful, and you need to monitor, and you need to make sure you know what you're doing. Now, these are people who are exposed to greater levels of pollution because their bodies are already dealing with a lot. Children, of course, pregnant women, and of course their unborn child, and the elderly. Again, it doesn't mean they can never use these things, but you need to have extra caution and precaution. I mentioned this last week. This is Dr. Duke's herbal death list. This was written by an ethnobotanist, James Duke, who is a PhD. And you can see here, people get very concerned, and you might have people parrot things. A lot of people just repeat what they've heard, but they don't know the source, and they've never really confirmed it's accurate, but they believed it when they heard it because they trusted the person who told them. So some people are really nervous about using herbs and supplements because, they've been told, oh, they could be dangerous and they could harm you. But as you can see here, 1 in a million from herbs and supplements, but 1 in 20 from bypass surgery. 1 in 80 iatrogenic hospital infection. Iatrogenic means that it's given to you via medical intervention. They cause the problem. Medical mishap, 1 in 250. If you get the wrong change at the supermarket, it's not going to kill you. Somebody makes a serious mistake in a hospital setting, it could potentially. Now, this isn't about me trying to scare you away from the medical world. I'm just telling you that herbs and supplements are safer generally by a huge margin than a lot of the things that we consider are normal to do and safe to do. So just consider that. And then I'm providing a couple of references here for well-done studies on essential oils. And this particular study talks about, the part of it, it's 90% monoterpenes that are reported to have that level of that anti-inflammatory ability. And then this study shows that aromatherapy can actually be effective for pain, depression, and feelings of satisfaction in the life of arthritis patients. It was actually seen to significantly decrease both the pain score and the depression score of the intervention group compared with the control group. So, since inflammation is at the heart of most painful conditions, acute injuries, chronic conditions, they could be a helpful adjunct when fighting pain. Things like muscle pain, stiffness, headaches, and of course, arthritic joints may benefit from the use of essential oils. Now, in this particular study, they used a blend: lavender, marjoram, eucalyptus, rosemary, peppermint, and then they did a blend of carrier oils: almond, apricot, jojoba. Everything was diluted to about 1.5% after blending. So, and they did specific parts, like it was 2-part lavender, 1 part marjoram. You can read the study. But but just know that this can be really beneficial for you, very, very beneficial for you. And you do need to, it's a learning curve, or seek somebody who's an expert, watch some videos, learn some things, but essential oils could really help. Okay. I will see you next week for part 3 and the conclusion of essential oils.